The Bioceuticals Integrative Medicine Awards are fast approaching. The Beamers showcase the outstanding talent we have in the Australasian integrative medicine profession and are held in conjunction with the Bioceuticals Research Symposium. To book your ticket to this gala dinner event, visit bioceuticals.com.au and click on the Education tab. This is FX Medicine. I'm Andrew Whitfield Cook. Joining me on the line today is Maria Shaflender, who's a clinical nutritionist with a special interest in mental health, gut health and genetics, as well as children's developmental health. Having encountered diverse health challenges throughout her childhood and adult life, ranging from digestive issues to mental health challenges, her focus is to provide an investigative approach to health and address her clients' health piece by piece. Maria has a clinic in Bondi, New South Wales, and Skypes clients nationally and internationally. She's also a Mind Foundation practitioner and an accredited genetic SNP test practitioner. Welcome to FX Medicine. Maria, how are you?
I'm great, Andrew. I'm really well. Great to be here.
That's good. Now, today we're going to be talking about hair analysis, and I guess with a particular bent on mental health, but you watch me go off track here because it's so interesting.
Mm-hmm.
I think first, can you take our listeners through your history and career? Because it's very interesting, and as you say, you know, you've overcome quite some substantial health issues yourself.
Sure. So my career in nutrition has started fairly recently, only about 5 years ago. Prior to that, I was actually in marketing, promoting some pretty toxic and processed foods and personal care products. I have quite a good understanding of, the marketplace and the way that we're bombarded with these things. But in terms of my interest in nutrition, that sort of evolved over time. I have always struggled with gut health, as you mentioned, and I think what really propelled me to start investigating a career in nutrition was my first child's health, my son, who struggled with food intolerances, and particularly he had a really long period of insomnia when he was about 3 or 4 years old, which was completely destroying my adrenals as well. So, I've actually investigated hair analysis at the time, and it was extremely revealing. And having addressed that over the next 2 years, it really made me realise the power of nutrients and diet and eliminating toxic metals, especially for children.
So what was it that tweaked you to say, I need to look at hair mineral analysis as opposed to other ways of assessing nutritional status?
Well, it was actually pointed out to me by a chiropractor that we were seeing at the time, who is also a nutritionist. And he basically said to me, you need to look at what's happening with heavy metals. So it was pointed out. I wasn't aware of that test at the time. And since I've started doing that with my kids, both my kids have had several hair analyses done, including myself as well. I've just, in my clinic, started using it for every single client and finding pretty incredible results. Being able to interpret it in line with the client's case, I think that's a really important point to make. It's not an isolated piece of evidence. It has to be looked at in line with what is happening with the client, of course.
Yeah, so I was going to ask you about your earlier experiences. Like, was it like a light bulb moment, or was it something that you had to really get used to over a period of time to, decipher the results and indeed what they mean?
It was, yeah, definitely there was some learning, and definitely I consulted the appropriate technical support and other practitioners, definitely. So it wasn't something I just deciphered on my own. I've learned from a lot of really amazing people in the industry who use hair analysis. on a daily basis, like myself now. So there was a lot of learning for sure. But the light bulb moment came, I think, when I looked at some of the hair analyses and compared them to what the person was presenting with, and it just was an amazing revelation to see how well their biochemistry was reflected in a really simple test.
So are you saying that they had biochemical analysis as well, and that this correlated?
Yeah, absolutely. So if the client happens to have their blood done, it's not about hair analysis correlating with bloods, and I think that's a really common misconception, and I think that's actually what's been stopping a more widespread usage of hair analysis, because agreed. A lot of physicians and even natural therapists compare blood test results to hair, and they're just completely separate things. They look at different parts of the body, and they look at completely different areas and tissues. So it's not really relevant to compare them. It's more about looking at the test results that a client has, whether it's blood or gut test results or other pathology, and putting the story together with the help of hair analysis.
Well, so let's talk about this interpretation. If you're doing a hair analysis, when is high in hair equal to high in body, like an overload? Or conversely, when does high in hair mean low in body, i.e. when you're talking about like a mineral loss out of the body and it's presenting in the hair? What's the relevancy? Do you want to give us some examples as well?
Sure. Look, I find that this one is actually very, very individual. So I've seen, especially with children, I've seen a few cases where they came up, for example, very high magnesium and zinc on hair coming off the chart. And, of course, they're presenting with behavioural problems and anxiety and fussy eating. So, you know from history that that child is going to have zinc deficiency, most likely. And, they're hyperactive and they get cramps. So they're probably going to have a magnesium deficiency. So right away, you know that those highs coming off the chart are actually a loss. But what I find is it's not consistent from person to person. So that's where you have to really use the clinical skills and understand their symptom picture, because I find it's individual. So a lot of the time they will present with low. So when it's obvious, when you have a really obvious case, I think you just get, really low zinc and really low magnesium, and they're lacking those nutrients, for example.
Yeah.
But also with a lot of thyroid cases, I find, and people who use hair analysis practitioners will notice this, I'm sure, where you have this really high calcium and magnesium coming off the chart.
Right.
It's not because they have too much calcium and magnesium.
No,
it's because they're losing it.
Yeah.
Exactly.
Have you ever seen issues where, you might have used hair analysis, let's say inadvertently, because you're tracking the patient's response, and you might have seen the nutrients rising as treatment is instituted, nutritional treatment? So you're actually seeing or tracking the benefit of that nutritional intervention?
Absolutely, yeah. And in terms of rising, it's very interesting to see that with toxic metals, because a lot of the time, and I'm going to discuss this at length at the upcoming webinars for nutritionists and naturopaths.
Yeah.
A lot of the time, the first hair analysis will come back with no heavy metals at all, and that's quite common because the person's detoxification capacity is probably impaired and they're not excreting metals. And once the nutritional program is instituted and you put in your zinc and your magnesium and your B vitamins, next time you do a hair analysis 6 months later, you have these piles of mercury or arsenic appearing on the hair analysis that were not there before. So when we know how minerals work and we look at the periodic table, we know that toxic metals have similar molecular weight and function to the positive minerals, like zinc, for example. So once you push through your positive minerals, you'll get this sort of spike of toxic metals. That's quite common. But that happens with the essential minerals as well. So once you start instituting the correct nutritional program, you'll see them come up, and that's usually a good thing because they're usually deficient. Most people are deficient in everything.
Right. So, okay, so when you're looking at toxic metals, let's take mercury because it's like the poster child of toxic metals. And let's say you're leading somebody through a detox. If mercury is rising, would that not indicate that there's obviously liberation from tissues, but how do you know that it's not being redistributed throughout other tissues?
Well, it probably is being redistributed through other tissues, and that's the scary part because as the body starts eliminating it from the storage areas, right, so usually the liver and the brain, it may go back into circulation through the blood on its way to elimination. So I think that's where we have to really pick up some binding tools, binding supplements, which have developed, I think, tremendously on the market and are now very safe and effective.
Yeah, Chris Shade was mentioning these, yeah.
Yes, exactly. To go through and, sponge up and pick up those metals that are being liberated. And, clients, patients will experience symptoms around that time, their detox symptoms for sure.
And if when you continue therapy, do you then see that peak go up and then drop off as the mercury is taken out of the body?
Yeah, it's interesting to see. I mean, obviously you have to make sure that there's no continued exposure. So that's where, you need to advise the client to stop eating tuna and swordfish. And
swordfish, yeah.
Yes, and, look at their environment. And usually I find, with mercury, there's not usually any acute exposure unless it's, industrial, unless the person is involved with toxic metals for work. Usually it's an accumulation from generations and generations. So once they understand to not take on any more mercury, then it's just a matter of pushing it out with detoxifying minerals and establishing correct gut function to minimise that reabsorption through the gut.
Yep.
And picking it up with some binders. Yeah.
What about things like iodine, selenium? Do you track those as well? And do you find that that's useful in tracking the efficacy of therapy in any way?
Yeah, absolutely. So with iodine, is not actually present on all hair analyses. It is on some. But with iodine, I actually use a different pathology test with the loading test, which is shown to be the most accurate so far. So there's a 24-hour loading excretion test for iodine. But yeah, with selenium and iron and zinc, which are all your classic thyroid minerals, you can see improvement, definitely. But I find the biggest clue to thyroid improvement on hair analysis is that balance between the big four, the calcium, magnesium, and sodium, potassium.
Right.
So as we know, adrenals play a huge role in thyroid health. So once that sodium, potassium starts coming up, which is a really good indicator of adrenal health and digestive health, and they start balancing out with calcium, magnesium, that's where I find the patient actually improves, the client's health improves a lot.
Now you've just said something that's piqued my interest. You just said digestive health. Now I'm wondering if somebody's got malabsorption and, let's say their body is therefore under a stressor, because it's trying to work under a lack of absorptive nutrients or absorption of nutrients. Do you find in poor digestion that you are getting wasting of certain minerals? And do you find as you repair digestion that the balance comes back, not just within, what, as you said, the big four, but other minerals associated with or that you can measure with hair analysis?
Yeah, absolutely. And I find, out of close to 300 hair analysis that I've done so far, I've probably seen 2 or 3 where there has been sufficient levels of mineral.
Wow.
And sufficient, absorption capacity that you can judge from the analysis. and there has not been many. So that's probably about 1%, I would say.
Welcome to the standard Australian diet from standard Australian soil.
Exactly. Exactly. It's really sad to see. I mean, it's obviously, the people that we see in clinic have health problems, and that's why they come to see practitioners. So the population is skewed to ill health, of course, but it's uncommon to see good digestive health present on hair analysis. And it's usually, I would say, hydrochloric acid and stomach related.
Yeah.
That's really easy to see from hair analysis. So then that flows onto, poor digestion and absorption and all of those things. Yeah, for sure.
And what about malabsorption? If we talk about let's say a nutritive, I'm going to use the word mineral, not to say that they're all minerals in the elemental, chemical form, physical form. If I use the word mineral for, calcium, potassium, sodium, zinc, selenium, iodine, which is a halide, of course, when you're repairing digestion, have you ever seen a comparison from before to after? After you're talking about you've done 300 plus tests, do you have a comparison of before and after and showing trends that you could track and maybe even predict in patients?
Mm-hmm. Absolutely, yeah. So I very much work with repeat hair analysis, and I think that's a point to make there is it's one-off hair analysis is not anywhere near as useful as tracking and repeating it at roughly 6 monthly intervals, depending on the client. But yes, you can most certainly see a before and after and all the deficient lines coming up and everything equalising. So everything on the hair analysis getting to a level which is the, so to speak, recommended level based on the research behind hair analysis. So once everything gets into that line, the person improves dramatically.
Yeah.
And they can see it as well. So it's very rewarding for the client to see that because they can see their health improve. And I've actually had, clients come back and say, oh, am I due for another hair analysis? I want to see what's happened since the last one.
Right.
So they get excited. It's a very visual test. So they get excited about seeing how their health has changed. And if it's properly explained to them what each of the minerals actually represent. So it's not just sodium or potassium. It's, you can talk about these are about your nervous system and these are about your digestive health. And you need to create a story about their health. And that's where I find it's very, very useful.
Okay, so I'm going to ask something. I'm just thinking about trying to trick your patients up here, and I'm wondering if you've ever, obviously you'd have to have a good relationship with your patient to do this, but have you ever been able or been in the position where you have been able to show a patient that they've been cheating? That they've been saying, hey, listen, you haven't really been adhering to what we've been, and they've admitted it? Have you ever seen this?
A couple of times, yeah. That's probably more to do with their digestive health, and stress levels, and adrenals. Yeah, it's very, very, it's impossible to cheat a hair analysis when it comes to adrenal health, particularly, and stress, because it's very easy to see.
Wow.
So it's not so much from a dietary point of view, but I find more from the stress level. Where, I've said to them at their initial appointments, we need to look at stress reduction strategies and your mental health and all of these things. And, they say, oh, yes, I'm doing yoga. Oh, yes, I'm going for walks. And they forget that there's a whole load of emotional stress there, for example, that hasn't been addressed.
Yep.
And then the hair analysis comes back and it's still showing quite a big adrenal dysfunction. So I've actually had not so much, people admit to cheating, but actually people burst into tears when I've mentioned that. This has happened a few times where I said, I can still see that there's a major stress in your life.
Right.
And that's all I said. And it triggers that emotional response.
Right.
So, yeah, it's a really powerful tool. And then actually some of these people have gone back and addressed their family situation, a situation with their spouse or work or any of those sort of really important factors that do put pressure on our adrenals and digestion and everything else. So that's been really powerful, actually.
I have to ask, though, hair analysis is not without controversy. I sort of vacillate here. I get that there, is difference between, testing laboratories, but there's differences in standard laboratories. So where did you, if you like, settle in your mind about the controversies with hair analysis, and what would you advise other practitioners to look into?
Sure. Well, yeah, as you've said, with any pathology test, there's going to be issues with accuracy and replicability. The lab that I use, so I've used the same lab for all my hair analyses so far, and I think that's a really important point, is that for a clinician, whatever test they choose or whatever lab they choose, to use the same one consistently.
Right.
So I think that's where you get that really fundamental knowledge that you've described when something looks wrong, because you see the same test all the time. So you understand that it has that consistency.
Right.
Look, in terms of different labs, there's labs that wash the hair, there's labs that don't wash the hair. There's, all sorts of different methodologies. I think it just comes to looking over their research and their methodology and understanding how it works, and making sure that makes sense. But, the biggest evidence that I've found for hair analysis is that it correlates with the patient picture.
Right.
99% of the time, and not all the time. There are some that come back that kind of just completely startle me. But 99% of the time, what you get back is what the patient presented with. And in terms of tissues, so hair versus nails, I'm pretty sure there's not that much difference, because the technology that's used in hair analysis can be used also on blood and nails. So it's the technology that is light reflective, I believe. So it's not really measuring the constituents, but it's using another method to analyse the tissue.
Gotcha.
I think between nails and hair, as far as I know, and I'm definitely not a technical expert on this, from what I've seen, it's very consistent.
Right.
So I think it's more about that consistency and picking the same lab and doing the same test, whether it's blood or hair or urine or anything else. And when you do a large number, you begin to see the same patterns, and you'll know straight away something was out. Yeah.
What about tissue sample collection? What about issues like contamination? Even, for instance, if you're going to snip the hair, using reasonable scissors to collect that tissue sample, being mindful of the shampoo that the patient has used. For instance, selenium-containing anti-dandruff shampoos, for instance. We were mentioning before about toenails. I would imagine, any pathology lab would be, very reticent to take a sample of an extremely nail polished clipping as well. There's a load of toxic minerals for you right there. But what do you say to patients, or is there a standard preparation method for the tissue sample collecting?
Yeah, so I usually will tell them that they just need to wash it with their normal shampoo beforehand. Look, I find, to be honest, the shampoo doesn't make much difference, whether it's an organic one or a full of chemical ones. That selenium zinc issue that you've mentioned does happen with anti-dandruff shampoos, definitely. So if I see a hair analysis, it will usually be very obvious. You will have the zinc and selenium coming off the chart. And then the first question is, what sort of shampoo did you use? So that's completely fine. And usually those people will present with zinc deficiency issues as well, which is why they're using an anti-dandruff shampoo.
Yeah.
So it's, usually fairly obvious. Definitely the hair has to be uncoloured. So for a lot of women, that is an issue, and there's an option of using pubic hair, which is a popular one. And
unless, of course,
just
they
making
colour that
sure-
too.
Yeah, haven't come across that yet, but I'm sure that's definitely a possibility.
The mind boggles.
Yeah, definitely uncoloured. So usually I will take the sample myself at the consultation. I find that much more effective.
Right.
So using my own clean scissors, the same scissors all the time, and then I can clearly see where the hair is being coloured or not coloured.
Yeah.
And I find that they prefer that, the patients prefer that because it also, I guess, establishes your expertise and knowing what you're doing. So the only times when I haven't done that is for interstate and overseas patients. So, yeah, I guess that's a bit of a limitation. But, as long as the instructions are very clear and the amount is indicated, how much they need to collect and from where, I find most people can get it right.
Yeah. I remember years ago, one lab, it was an overseas lab, and they were basically pumping up their own testing, saying, that other labs, were they doing a hair analysis or an air analysis because they had a clean room and things like that. But I started to wonder about this, and I thought, well, just how sensitive are we talking here? Like, are we talking, nanograms of molecules of minerals? And then I thought, well, what's the real relevance? So it's kind of like, I started to question it are they just doing a marketing parade? And I started to sort of think about the actual relevance of the minerals, the amounts of minerals, nutrients, elements that we're testing in hair analysis. What do you find here?
I find that sort of minute calculation is probably not that clinically relevant. I have to say, I probably can compare it to using a gut stool analysis.
Right.
Where, some labs measure their gut bacteria to the billionth particle, and, some labs will just say 4++, and, that's the overall population of that particular bacterial genus.
Yep.
So it's, whether you need to look at whether that's clinically important or not. Or whether, that amount of zinc, whether it's at a 6 or at a 6.5, it's not really that important. It's more important to look at all the minerals in relation to each other. And the biggest thing that I want to convey about hair analysis is it's the patterns that you're looking for. So it's not so much the exact calculation of each mineral that's important, it's their ratios and relationship to each other and the overall picture that presents.
Yeah. So the other question I was going to ask was about heavy versus soft water. Again, what do you find?
Well, look, I find it's not really that important. I just don't see those sort of, distinctions in the person's lifestyle, where they come from. They're not really significant when it comes to their hair pattern. It's much more correlated with their actual health and their symptoms. So whether someone lives, on a farm or an interstate, I found some geographical correlations. So, for example, I had a few patients from Canberra and they all came up really high with, I think it was nickel, or a toxic metal that's not highly toxic but is not desirable.
If the water supply does have an excessive amount of something, then that may show up in the hair. And I guess you're talking about intake of water, not washing of water.
Oh, exactly.
Yes.
Yeah, no, absolutely. It's actually in the body. So whatever is in that water that they're drinking is in the body, unless they have a really good reverse osmosis filter, which, more people are getting these days, but most don't. So whatever is in their hair is actually what's being drunk as well. And I guess it's the same thing with environmental exposure, where you mentioned previously, contamination from the environment. So if someone is working in a welding shop and they're exposed to toxic metals for 10 hours a day and their hair is contaminated, everything else is going to be contaminated too.
Yeah.
So, they're breathing those metals and they're touching them through the, getting exposure through the skin. So it's not, I don't really see it as contamination.
Have you seen that with like occupational exposure? Have you been able to sort
Absolutely.
Wow.
The occupational exposure are the worst affected people, for sure.
Right.
Yeah.
Has anybody, indeed have you, been able to track those populations which have fluoride added to their water supply versus those that don't?
Well, unfortunately, fluoride is because it's the halide. It doesn't show up on hair analysis.
Right.
Which is very, very frustrating. So they're not able to track it. But with fluoride, I think it's a different issue because obviously thyroid health comes into that.
Yeah.
So that's more to do with, once they implement a water system in their home that takes out the fluoride, and we replenish the thyroid nutrients, that's where I see that come through.
Yep.
Yeah, fluoride is a little bit tricky. But occupationally, I've had clients who are farmers and who work with metals, so even builders, but more sort of direct contact with, making fly screens, aluminium fly screens and things like that. Their toxic metal levels have been pretty dramatic and very, take time to clear that out. But, a lot of them have had to stop their occupation.
Right.
And choose something else. Yeah.
Talking about toxic metals or toxic minerals, and forgive me for lumping them all under that subject mineral, it's just easy. But things like lead, that are deposited in bone and that are obviously slowly metabolized with bone metabolism, do you find that if you might do a comprehensive detox with a patient, if they had high lead, that then all is said and done, their lead levels decrease, happy patient, and then if you revisit that patient years later, that you see that the lead levels rising again with bone metabolism?
Yeah, look, that's an interesting one. I mean, I haven't been in practice, unfortunately, for long enough to see, that really long-term excretion. So from what I've seen, definitely the heavy metals like lead and I find aluminium also takes quite some time to clear. Actually, mercury seems to be easier to clear than some of the others.
Yeah.
So, look, with lead and bone, definitely need to work on their bone health and their alkaline balance and acid and alkaline balance. So, it's, instituting that nutritional program is very important. But I've actually, one of the mentors in hair analysis, who's a practitioner in New Zealand, who's been around for a really long time, when he presents his case studies, he goes through those really long-term, sort of over 8 to 10 years case studies where he can see major changes in the toxic metals and their metabolism.
Gotcha.
Yeah.
That would be really interesting to look at. Because, I get that it's controversial, but there's a lot of these functional tests which are controversial, but I also think that they're lambasted without true cause as well.
Exactly.
And as you say, you're responsibly looking at the big picture, not looking at one test to direct therapy. You're looking at it to guide therapy and to give you answers.
Absolutely.
Yeah.
It's definitely not instead of the blood test or any other pathology. It's a really great additional tool.
And so you've mentioned things like thyroid, which I've got to say I never thought of, tracking the health of a thyroid problem, a thyroid issue in your patients. What other conditions does hair mineral analysis really, and forgive this pun, shine?
Sure. Well, I actually do a lot of mental health work, so it seems to just sort of find me. I've never chosen to, specialise in that or anything like that. But with mental health, I find it's very, very revealing to look at hair analysis. And one of the case studies that I'll be presenting in the webinar series is a bipolar case study. where, I've tracked, done an initial hair analysis which showed some significant zinc and copper imbalances, as well as vitamin B12 metabolism imbalances, and instituted a program. So this person actually was a typical pyrrole case. So instituted a program to address his pyroles and his blood glucose and his methylation, then retested that same person 12 months later. And it's quite amazing what turnaround has been achieved. So also children with developmental disorders, so autism spectrum and various learning difficulties.
Yeah.
I find with children, particularly hair analysis, I find it invaluable, because usually it's what you see is what you get with children. There's no layers of disease. There's just simple metabolic patterns that present, and heavy metals that present. And I think that's a really rewarding part, and that's kind of where I started with hair analysis with kids. And any clinician that sees children, I think, needs to really look at hair analysis as a really useful clinical tool.
Yeah.
Because it's just so simple to address, and the results that you see can be seen very fast as well. The treatment implementation and the results are very quick to show. So,
can I just ask you a little point about that? Given, like autistic kids, some of them have a real issue with that hypersensitivity of the sensation of having their hair cut. How do you handle it? How do you get through with these kids?
Distract them with a phone or a screen. No, it's interesting because they definitely don't like it. So right away you can tell, sensory child, as soon as you touch their hair as lightly as possible, they react negatively. So usually, with the little kids, I get them to sit on their parents' lap. Yep. And, they're being held and comforted whilst it's happening. Mm-hmm. And I've just become very, very swift at doing it quickly.
Right.
And getting enough hair the first time
yes.
so that it's a very quick operation.
Right. Because I always wonder, is it better to try and get the child used to it and try and take away their fear, or is it sometimes you've just got to be pragmatic and get the thing done?
Yeah, I think with a test, you just need to get in there and get it done. But then I guess the whole point of them undergoing a nutritional protocol after that is to reduce those sensitivities. And, as we know, there's definitely nutrients that play into that hypersensitivity.
Yeah.
So addressing that, I found that with my own kids as well. Once their nutrient levels are at an adequate level, their sensitivity reactions are significantly reduced or eliminated.
Right, yes. What about other mental health conditions, or indeed any other conditions that you find of real use with hair mineral analysis?
I actually find, it's just through the sheer number of patients that present with the thyroid and adrenal picture, it's really, really useful. Unfortunately, that's the most difficult one to address because it does take a long time to turn the entire metabolism around.
Yeah.
Thyroid and adrenals, mental health, so anything, depression or anxiety, insomnia.
Insomnia?
Pretty much any condition I find. I run a test with every single patient that comes through. So I don't think there's any condition that can't benefit from looking at that investigative approach.
Well, we all have minerals, don't we? Now, there was one other issue of contamination which I forgot about, smokers, or indeed children when the parents are smokers. Yeah. How do you find the hair mineral analysis there? Any issues with contamination?
That's a really interesting one. No, not so much from contamination, but from intoxication.
Right.
Of cadmium and nickel usually. So I find with smokers that I have seen, I don't get that many smokers, funnily enough. I think people are getting the message, but the few that I have seen on their secondary, so the retest hair analysis, a lot of cadmium was coming up up straight off the charts, and nickel as well. So it's very interesting for them to see, and one of them was able to address it instantly. He pretty much said, "I'm quitting now," and he did.
Yeah.
Because he realised how much it was affecting him. And another one was a younger girl who, unfortunately, due to social pressures, wasn't able to do that, but really revealing to see how much toxicity is sitting in that person due to cigarette smoke. And it's, when we look at what cadmium does to the body and how much of a neurotoxin it is, it's quite incredible that there's not more publicity around it, because these people are literally being poisoned.
Yeah. Just a quick question about limitations. Like false positives versus false negatives, wrong excretion route for that nutrient or mineral or toxic mineral or whatever. Or what about other pathologies limiting normal hair growth?
Look, I haven't really come across that many false positives or negatives, because it's, we are looking at that overall metabolic pattern.
Yeah.
So a lot of the time, what I have found is, very interestingly, the most significantly sick patients sometimes get one of the most normal hair analyses
Really?
the first time. And this is a bit of a paradox. I've only had maybe 3 or 4 who presented, either with serious psychiatric issues or serious long-term infections where, I know that their body is not working properly, and the hair analysis comes back and looks fairly normal. There's nothing really that out of order. But what's interesting with those is the metabolic type. That is, a descriptor that comes back with the hair analysis is usually the worst type. So it will usually be like a slow 4 or a fast 4, which tells us that the body is actually under severe metabolic stress.
Right.
So what I find with those patients is you need to really institute a program that's appropriate and then retest 2 or 3 months later. So a much shorter retest time that will show the changes that have been instituted.
Yeah. And would that also direct you to more appropriate tests then?
Absolutely,
yeah,
yes.
Right.
And then there's other missing pieces of the puzzle, definitely.
Gotcha. So now you've mentioned a couple of times you're developing some webinars to help practitioners, and indeed that's my last question for you, resources available for practitioners to learn from.
Yeah, I've got some webinars coming up, and these really came about just through, the social network between practitioners, Facebook groups and things like that, where I was being asked a lot of questions about hair analysis, and I thought, well, this could be actually really interesting, because the case studies that I've seen are really significant and could help a lot of other practitioners. So I've decided to develop these webinars that are coming up soon and share the knowledge.
Excellent.
And my love of PowerPoint charts.
well, you know what I like? What I'm most impressed about is that it's a practitioner teaching other practitioners rather than a company saying, look what we've got. Because obviously there's always that undertone of, hang on, what are you trying to sell me? I like the fact that it's going to be, appropriate, responsible use, and looking at where it can be appropriately used and where it indeed can't be. So I'm very impressed. Good on you.
Thank you. Thank you very much. And look, in terms of resources, I guess the first port of call for practitioners is to call up the company that they're testing with, because they have technical support and they do, of course, see a lot of hair analyses or other pathology. So they are the first port of call. But I find the value that I can add, I think, in this area is through that case study application and looking at the patient relationship and the patient's treatment. So not just the test in isolation. And I think that, that's where the value comes in.
Well, Maria, we'll definitely put that the link up for those webinars on the FX Medicine website so that our listeners can access those if they wish. So
Brilliant.
I've got to say thank you so much for joining us on FX Medicine, because I like the way that you approach it. Obviously you're a fan of it, but you're a fan of it because you've seen the results, and the results have been in helping people, and that to me is the big be-all and end-all. You know, you're helping people, particularly with mental health issues and developmental disorders, and that I really take my hat off to you for doing that. So well done.
Thank you. Thanks. I really appreciate it.
This is FX Medicine, and I'm Andrew Whitfield Cook.
If you're a healthcare practitioner and want to learn more about how to develop more targeted treatments for your patients using genetic testing, then Bioceuticals DNA Testing in Practice is for you. This 10-module professional development course, presented by Dr. Denise Furness, is designed to help you unlock your patient's health potential. You'll learn how to move away from the trial and error approach that so typically leads to patient dissatisfaction to a targeted clinical model defined by decision-making that distinguishes those patients most likely to benefit from a given treatment from those who will not. For more information on the DNA Testing in Practice 10-module program, visit the Bioceuticals website or contact your Bioceuticals sales representative.